Hello, everyone. Welcome back. In this set of video lectures, we'll be covering coding diseases and disorders of the neurological system. Let's have a look. Okay. Again, as discussed, this is coding for diseases of the nervous system, covering codes G00 through G99. And again, pay special attention to the section in the text where they cover the main terms. Please answer the questions that pop up on screen. They'll help you retain the material better. So these codes, G00 through G99, cover a lot. We see codes for inflammation of the brain and spinal cord, diseases that break down the nervous system, nerve problems, seizures, cerebral palsy, polyneuropathy, and many other things. So a couple of things that you can see in your text. Please pay special attention to figures 9.1 and 9.2. They cover the anatomy of the nervous system. When we use the term central nervous system, we're talking about the brain and spinal cord, but we also have things that happen to the peripheral nervous system. There's special rules for coding these, and here's an example. If you use code G89 for pain, you also need to code any psychological factors related to the pain. For hemiplegia, in other words, paralysis on the one side, you'll need to say if it's the dominant or non-dominant side, and we'll get into what exactly that means in just a little bit. And of course, we'll code for psychological factors. There's some pain codes that you'll see excludes one nodes and excludes two, so it's important to know the difference. And here's an example of that. Under G89, pain not elsewhere classified, we code the psychological factors and we see an excludes one node. In other words, this is mutually exclusive of what is to be not coded with these codes in code category G89, right? And G89, of course, is generalized pain and pain disorders exclusively related to psychological factors and unspecified pain. We also have an excludes two node that tells us what other pain codes can be used with category G89 codes. And again, here is another excludes two node at the beginning of the chapter that states conditions from other chapters can be used in addition to codes for the diseases of the nervous system. And again, please pay special attention to the notes in this chapter. You'll see such things as use additional code, code for underlying disease, use additional code for adverse effect when appropriate, code any associated condition, and so on. Now we get into the dominant versus non-dominant side. So when we talking about this, we normally talk about whether somebody is right hand dominant, left hand dominant. You'll see a lot of these written up in neurology consults. So the codes from category G89, hemiplegia and hemiparesis, they identify whether the dominant or non-dominant side is affected. So for an ambidextrous patient, the default is dominant. If the left side is affected, it is non-dominant. In other words, we assume everybody's right-handed or unless otherwise stated. And if the right side is affected, the default is dominant. Now for guidelines on pain. Pain can be the main reason for a visit, in other words, pain management, or it can be used with other codes. You'll use them for pain from devices after surgery, chronic pain, cancer pain, and chronic pain syndrome. What is the first listed code or the principal diagnosis in an inpatient setting is the reason that the patient came in. Now we get into meningitis. What is meningitis? It's the inflammation of the meninges. These are the membranes that cover the brain, the spinal cord. You can see a diagram of this in figure 9.3. Meningitis, in other words, this inflammation of the meninges, can be caused either by a bacteria or a virus. So important to know which type of meningitis we are coding for. And that's all I have for you. Come back for our next video lecture. We'll talk more about coding diseases of the nervous system. Bye now.